Medical emergency? Of course, you head to the ER if it's serious. How about a mental health crisis? Thousands of Coloradans have been going to the emergency room for those, too. That includes children. Our Anusha Roy looks at the result.
For 6 months, the patients coming into Denver Health's emergency room have been getting younger.
To the point where every day we do see children.
Some of these kids come straight from school and their parents are called to the ER.
Like the teachers are not able to manage them behaviorally.
Or their families bring them here when they don't know where else to go.
They may have been at home and then said something like they feel suicidal or they're really depressed.
We're surprised that it was as high as it was for children under 18.
In that same 6-month time span, the Center for Improving Value in Healthcare was studying data and found between 2016 and 2018, 17,000 Coloradans went to the emergency room and received a mental health diagnosis. 1 out of every 4 of those visits were kids under the age of 18, often diagnosed with depression.
Because this data only shows us who is coming, it doesn't really tell us the reasons why.
We're the first available access, so we're open 24/7.
For people who have been told to wait when they can't, they know they can come here. While they don't always know who else is out there to help, like the Colorado Crisis Services, which is why the state launched a campaign called Below the Surface specifically for kids.
Some of them will tell us they have an appointment a month out. They might be able to call and there's nothing available for another 2 weeks.
If it's an emergency, this is the right place to be. But for the kids who might need long-term care, a short visit with an ER doctor isn't the ideal place to start.
When it comes to safety, sometimes it's the best available option.
So the state also has a new law that's reinforcing penalties to make sure people are getting mental health care appointments within a week. I'm saying reinforcing, though, because this was already a law, but a lot of people weren't following it in Colorado. So this new state law is essentially saying Colorado is serious about this. Get people in as soon as you can.
Talk about these young people who are having trouble at school and end up in the ER. You would hope that these resources would be there, like on the school campus for them.
Yeah, and that's been an ongoing conversation. And Denver Health has actually set up clinics in 18 different schools in Denver specifically for this, so that access to therapists and help can be as easy as possible.
All right. Thank you, Anusha.